We are now recording. Thank you, everybody. Happy St. Patrick's Day. We are going green today in honor of the holiday, and we have leaned hard into the theme, as you will see. So, thank you for joining us for the luck of the SEP. What is a SEP? We'll talk about that, obviously. And ain't no luck about it. Although that's a bit of a misnomer, and we will get to that. There shouldn't be any luck in your expertise in the questions you're asking. We want to take the guesswork out of special enrollment periods and make sure that all of our enrollment assisters in Wisconsin are armed with all of the information they need to do this work well, and that people have every opportunity, the people we're helping have every opportunity to get enrolled through the marketplace. Today, I am joined by Julia Garvey, Community Health Enrollment Supervisor at Partnership Community Health Center. She is also the Outreach and Enrollment Peer Learning Network lead, which means she leads a team of CACs and shares information about this work. My name, Adam VanSpankeren. I'm the Navigator Program Manager with Covering Wisconsin, which means I have the pleasure and privilege of leading an incredibly dedicated team of navigators, enrollment assistance experts who get to use this knowledge a lot more actively than I do throughout the year and can probably point you at a SEP. And they know all this stuff, and they'll probably be able to answer questions and participate in the Q&A if needed. But really, they are an incredible team, and they have helped so many people get enrolled, including this last open enrollment. But as Julia would say, it's the rest of the year we're worried about now. We have, is it 46 weeks that aren't open enrollment, and we really need to think critically about this work and what we do. Julia, do you want to say hi?
Hi.
All right. It's mostly me. Julia's going to chime in as needed. She's also we will stop periodically and answer questions after each section or so. We have plenty of time, and we have plenty of time for the Q&A portion at the end as well. But Julia is as passionate about this work as anyone. And certainly I'm happy to have her here joining me, because when you're doing this work, when you're looking for special enrollment periods, think about the consumers out there. You want people who really get excited about this stuff, who nerd out over the challenge of finding ways to get people enrolled. That's what this work is all about, and that's what this work is all about for most of the year. So hopefully that's why you're here. Hopefully that is what you're excited to learn today. And we're going to get into some pretty complex topics. Thankfully, we have a guide. We have our Seprecon. As I said, we went hard on the theme. We went hard on the theme. And I do want to shout out Tina Marshallek from Covering Wisconsin as well for going through the slides and reviewing them and making sure that I was thinking critically about each of the topics that I wanted to introduce today. So the Seprecon is our webinar guide. They're going to appear and offer helpful tips as we go whenever there's something we can expand on a little bit. You'll see language in green throughout the presentation, and we'll explore hopefully taking things that you know, things you don't know, and adding to them just a little bit. So this whole thing should be educational for everybody. Use the Q&A for your chat. I see, Carla Gaines in the Q&A. It's good seeing you too. Julia is going to monitor their chat, so I don't have to look off to the side, thankfully, luckily for me. But we're going to go through a number of topics today. We'll talk about your toolkit as an enrollment assister. Hopefully that language is somewhat familiar. If you've been to our conference, that language should be somewhat familiar to you. We're going to go back to basics for Special Enrollment 101, really talk about the fundamentals of this work, what you need to be looking at, the questions you need to be asking, how you should think about this stuff. And then we're going to build on that, right? We're going to take the most basic kind of bread and butter special enrollment periods that you see. You can see some of them on our fact sheet to the right there. And then we're going to talk about income related special enrollment periods, which is where it starts to get a little bit more complex, as do the reasons you might be accessing them. We'll talk about less common SEPs, things that you might not use all the time, but are incredibly valuable in terms of getting people enrolled in marketplace coverage. We'll look at some other considerations, things that might be curveballs, but you will see. You will see if you do this work long enough, a little bit of everything in this presentation, and you want to know how to handle it. We'll talk about a few state-related updates and resources at the end, and we'll do a dedicated question and answer to wrap up the time. But we have plenty of time, and by all means, please use the breaks at the end of each section to ask questions. Ask questions throughout. Julia's gonna jump in at those times and let me know if there are questions, because we don't want to get too far away from any given topic before we, address a given concern or somebody wants something expanded upon, we're going to go ahead and do that. We'll dedicate the time. We've got 90 minutes, and that is a lot. All right, so opening your toolkit. Your toolkit being, if you're an enrollment assister, what I think of as your toolkit, all the bookmarks you have, the things you have taped to your wall, the fact sheets you readily give consumers, all of the things you regularly refer to do this work. We're not going to go through all of the things in your toolkit because there'll be things like your FPL calculators and different things on the Medicaid side, for example, that we're not going to need to look at for the purpose of this presentation. But there are certainly things that you're going to want to look at. Number one resource, the gold standard for doing this work is Health Reform Beyond the Basics. They do webinars. They have this incredible special enrollment chart that we'll be referring to throughout this presentation. We're going to look at it really closely. We're going to look at a few things on it just as they come up, but it is a wealth of information, and it is an incredible resource for enrollment assisters. The chart is the site. Health Reform Beyond the Basics is all resources. It's incredible. You're going to want to check out their last SEP webinar as well. It was done, I think, in 2024, but the information is still incredibly relevant. Same thing with the chart that was 2025, but they removed a SEP that we'll be talking about that's no longer relevant. So that is really, this should be bookmarked. If you're doing this work, you should probably bookmark it now if you haven't already. And really, I love doing this presentation, and I want to invite everybody to take the time to do something I do. I love doing this presentation because annually, every year at this time, I get to go through and refresh my knowledge, go through this chart, have it ready, look at it in detail, really read it from cover to cover even. In addition to all of the different resources we'll be talking about in these coming slides, really take the time to re-educate yourself, even if you've been doing this work for a long time. It is an incredibly valuable exercise, and you will remember things you've forgotten. You'll be surprised by new information that has developed, either something that you weren't aware of because of a policy change, something that's been sitting there forever that you haven't had to deal with. And really, you don't become an expert on it until you have to do it. So really, the exercise of refreshing yourself annually and going through your resources, checking your bookmarks, and actually doing a deep dive and reading them before they come up in an appointment is going to save you so much time, so much energy, and it's really going to help the consumers because you're going to be so confident in what you're doing. Because don't expect you to have this memorized. I don't expect you to have any of the things we'll talk about today memorized. Maybe a couple, and you probably know what those are because we're going to spend maybe the least amount of time on those. But knowing what avenues you have to help somebody get coverage is just an incredibly rewarding use of your time. And I highly encourage everybody to do that and go through their resources at least annually, if not more often. So looking at this SEP chart, there's a number of categories you can see. It's several pages long. This is only one example, and honestly the most basic example, but you want to know what it says. The language they use, Health Reform Beyond the Basics uses on this chart, refer to this is the language of this work. And knowing each of these categories, each of these columns, understanding them means whether or not you're going to be able to successfully get a special enrollment period for somebody that you're trying to assist. Qualifying event. We'll talk a little bit about qualifying events and including the loss of minimum essential coverage in a minute and what those things mean. But basically, this is your trigger, right? This is what has happened that is going to qualify somebody for a special enrollment period. The requirement of prior coverage is an incredibly important distinction because the marketplace will often require somebody had coverage in order to get a SEP. It's become more and more restrictive over the years. There were times, I think, early on in healthcare.gov's lifetime where you didn't necessarily need to have prior coverage, or you didn't need to necessarily be on the verge of losing prior coverage. And in some cases, there are still some special enrollment periods that you don't, and we'll look at some of those. But for the most part, we see updates and policy updates every single year or every other year at least, where they now say, oh, you should have had coverage in order to access the special enrollment period. The timing we'll talk about as we look. We'll go back to basics in just a minute and talk about special enrollment periods. And usually you're going to see something like 60 days, 60 days after X happened to get coverage through the marketplace, 90 days for Medicaid or CHIP. We'll look at that. Coverage effective dates. Oftentimes, you're going to see the first of the month following the loss of coverage. A lot of times, you're going to meet with the person before that happens to make sure there's no gap in coverage. There'll be things like looking at the birth of a child, in which case your effective date is going to be a little bit different. Um, but really knowing when that coverage is going to start is going to help that consumer plan. It's going to help them know when they're going to be able to get their medications, know when they're going to be able to get their care. So looking at things like this chart or having this information at your fingertips is going to be so, so important in advising consumers to do this work. Plan selection, limitations. This is, again, this is something that is becoming more and more relevant to our work, especially as Julie and I have spent a lot of time talking about this. Special enrollment periods, as we'll see, are not just opportunities to get coverage for the first time. That might be what we do most of the time, or get coverage through the marketplace for the first time, if somebody is losing that coverage. But there are often these restrictions that are saying, okay, no, you need to stay, if you're with the marketplace, you've got to stay in the same meta level. There are times when that doesn't apply, and there are reasons to do that, and we're going to look really closely at those. But the thing about it is there are so many changes happening annually now. We just saw so many with the marketplace where someone might need to change their provider network, or they are becoming eligible for cost sharing reductions and want to change and take advantage of those. And we'll look at those special enrollment periods today and make sure that you guys all feel comfortable accessing them and knowing which steps will allow you to do that, because a lot of the times it's open enrollment. We help most of the people, I think, that we see in the year during that very tight window for the marketplace. And we need to keep this in the back of our head, because what somebody will be selecting during that time period, during November, during December, they could be locked into, if not that plan, that meta level for the whole year. And there are implications with that. So it's definitely something to be aware of. Hey, I'm having this conversation with the consumer. I'm asking them all the questions so I can forecast and say, oh, they might have a change, an income change that's relevant. They're talking about losing a job, or this job is just temporary. They might have a change in circumstance in March or April that's going to allow them to make a change to their marketplace plan, and they might want to do that. And we'll look at that more closely as well. And then the step generally granted by, you'll see basically on the chart two different categories more than any other. And one is the marketplace application, which is what you're going to see most of the time, right? Most of us do this work by logging on to healthcare.gov with the consumer, walking them through the application, and answering the questions the right way. So it's going to give you that special enrollment period. That is what it means when it says marketplace application. And that is going to be most of the steps. However, the other thing you might see on this chart is CMS caseworker, which means picking up the phone, which means I need to call the marketplace with this consumer and tell them what's going on, what the circumstance is. We're going to have a number of different steps we look at today that can only be accessed by calling the marketplace. And we're going to tell you why to do that, some tips on things to have done when you're doing that. And really don't be afraid to pick up the phone. When in doubt, I tell people, whether you're using the application, the actual website, or calling, if you think that there should be a step, go for it. Go ahead and go through all of the steps when helping a consumer. See if the site's going to grant it to you. Great. If it does, awesome. Just go for it. If you tell the person on the phone, hey, this is the circumstance, it should be a special enrollment period, and they grant it, awesome. Great. Whatever you need to do, either way, go as far as it will let you. And you'll hear that language again. But really, really, really just try. Like, if you think there should be a step, and based on everything you've heard today, really, you should go for it. Because if you think the site is saying, no, there shouldn't be, then pick up the phone. And if the site has granted you one and everything is going great, awesome. Just take it, help that consumer pick a plan, and move forward. Another great resource, obviously, we're talking about healthcare.gov. Healthcare.gov is surprisingly good, and I'm no longer surprised by it. I think last year I had language where I called out that it was just a pleasant surprise that the language and the different resources in healthcare.gov were really solid. They are mostly, they're attempting to write for consumers, right? They're attempting to write for the people we help so that anybody can understand the stuff. And they do a pretty good job for that. But more than anything, the language there is perfect for us, right? When I go looking at the SEP list or the glossary, I know what I'm looking for, and the language there makes sense to me. It is perfectly targeted for enrollment assisters. So people trying to help consumers enroll in coverage. So when you go to healthcare.gov, you're not sure about a term, or honestly, even if you're pretty sure of the definition of something or it's something you work with all the time, seeing how healthcare.gov defines it can be really useful. And actually, let's expand on some of those. Before I do, I just want to actually call it the fourth bullet point there, because we'll look at these other three in more detail. But the C plans is, as many of you, hopefully most of you know, is the plan preview tool. And again, as we're doing this work, there are a lot of things you can do with a consumer before you pick up the phone. You're asking a lot of questions before you open the website, before you call the marketplace. And one of the things you're going to want to do, just as a reminder, when you think about the conference we do or open enrollment, you can help a consumer. You can collect that basic information, their income, their household, and you can look at the plan options they have available. So as you navigate trying to access maybe a challenging or an uncommon special enrollment period, they can have the plan they want in the back of their mind. You can have it ready to go. So if you have to pick up the phone and call the marketplace, once the SEP is granted, you're ready to go. You can just tell that marketplace representative, I want this silver plan. This is what the one we wanted. Here's the plan ID. Let's go. And then your work is basically done at that point. Insofar as our work is ever done. It's not ever, there's always more to do, but for that consumer, for that moment, that call can be done. So looking at the SEP list, again, this is one I recommend looking at it all the time, certainly every year. But when you're working with the consumer, those questions I just mentioned, you're going to ask them all kinds of things. You're going to ask them, hey, any recent changes in your life? Tell me about your income. Tell me about your household. Have you recently lost coverage? All of those things. So you usually know what you're looking for. But sometimes a consumer will come to you and you're just going to be kind of hitting your head against the wall because you're like, oh, it's just not working out. And I pull up the SEP list, right? I pull up healthcare.gov, special enrollment period, for two reasons. One, I want to look at every single one of those categories, even ones I know well, and I want to make sure I'm not missing anything. I want to have considered every possible angle on this consumer situation and make sure that at least I know I've given them the best assistance I can, that if they have an avenue to coverage, we found it. And the other side of that coin is when there isn't one, when there's no pathway to coverage, sometimes you just need to show the consumer that. You need to say, hey, this is everything I'm seeing. These are all the questions I just asked you. We're kind of stuck. And, you may be looking at things like, free clinics and financial assistance and things like that at that point, but at least you've done everything you can. Things like the glossary, not to belabor the point, but really, really, really just going through how the site defines terms. So you have the knowledge that you've accumulated in learning to do this work and all the experience you've had since, but going back and looking to see if those definitions have changed. Bookmark the glossary is a great idea. Looking to see what policy changes are reflected. You'll see one on the next slide even. And honestly, a really great tip also, go to the bottom of the page because there's other things that are linked up that often relate to the topic you're looking at. So when you are say, hey, I want to look at, I see cafeteria plans, for example, just to pull one off the list in front of me. And, you're looking at something there and it links to, and you'll click that link just to see where it takes you. You want to see what healthcare.gov thinks is a related topic that's going to assist you. Cafeteria plans was a bad one to pick, but still, you'll want to see what other topics are related to what you're looking at, because it, as you'll see in this presentation, can take you to even more valuable links, things that you'll want to use, things you may need to actually do whatever steps it's recommending on that page. Eligible immigration status is one that I have bookmarked because there are people who work with a lot of immigrant populations, and they may very well have this memorized. I don't pretend to. I know quite a lot, but I never feel 100% sure that I have this list memorized, and I don't want to make a mistake. So I'm always accessing this. And you'll see, like I said, you'll see policy changes right there on this page. Like for DACA, as unfortunate as that update is, a lot of the pages have very timely updates and call out boxes and things like that, so you don't miss them. But certainly this page, you'll see as an example of those links at the bottom, a list of documents you'll need to fill out the marketplace application. So again, a consumer comes to you. They've got all their documentation in front of them. They hand you a piece of paper you've never seen before. You're not sure if it's going to work for verification. But it might be on that list, so you're going to follow that link. Similarly, as I was saying before, if your hands are tied and you've looked at absolutely every door you could possibly try to open, the information on finding a community health center could be incredibly valuable. So don't ignore the links on the healthcare.gov pages. They could be incredibly useful in furthering your ability to assist a consumer. And then this one, obviously, the times are changing, and this is worth noting. Um, whether we want to or not, there's a lot of reasons to Google things doing this work. There's oftentimes pages on the state site or a different .gov or anything like that where we know there's information out there, and we just Google it. And honestly, nowadays we can Google whole questions, and we get AI assistance whether we want it or not. So if you whether or not that's something you mean to use or it's just kind of happening because you Google the question, you're going to get response from artificial intelligence, and you need to be aware of that. So keep in the back of your mind some of these tips. How you ask your question matters. Think of all the context that you just got from that consumer. Everything you ask them, make sure that the prompt, what you're asking, is incredibly clear and you're not leaving out any key information. You want to be very specific. Obviously, I think the main takeaway is don't trust everything you get from an AI assisted search. AI is not always going to be accurate. I don't want to discount it and say that it's never accurate, because it absolutely can be. And if it's accurate and you've been doing this work for a long time, it'll look right and probably just reconfirm something you already know. But the best thing you want to do is look at the source, right? Go to whatever source it's citing and look for a .gov or a .org you trust, and make sure that that information is accurate. You don't ever want to take it on blind faith, because enrollment systems work is not something that's going to be replaced by AI, hopefully anytime soon. And there's a lot of nuance to what we do that might not be reflected in an answer that for a question you just searched. So always verify the source of the information. Always make sure you understand the answer that you're giving a consumer, because what it says and what you need to tell the consumer and how you need to explain it might be very different. So just keep that in mind. All right. Julia, do we have any questions as we wrap up that first section?
Nope, you're good.
All right, and we'll keep going. Special Enrollment 101, we're going back to the basics. What is a SEP? Use the word SEP a lot. I've talked about special enrollment periods. If we're this far, hopefully you know what it is. But it is a window of time outside open enrollment when you can sign up for health insurance or help a consumer sign up, usually after a qualifying event. We talked about qualifying events a little bit. We'll see more of them. Usually there's a set amount of time, like 60 days, where somebody can enroll in coverage. Usually it's best if somebody enrolls before that time actually begins, because it's 60 days after the event, and usually that event is after I lost coverage. But I want to keep in mind, or people to keep in mind, that SEPs can also be used to change marketplace plans. That language, if you go to what is the SEP on healthcare.gov, it's not right there. There's a whole separate page for it, but it's not apparent that that is how we should be thinking about special enrollment periods, but it absolutely is, especially as provider networks change, especially as plans pull out of areas and the repayment caps, for example, go away. There are a lot of reasons to change marketplace plans for a consumer, and work with the marketplace throughout the year in ways that we might not have considered or might have taken for granted before. So keep in mind that somebody with insurance through the marketplace could come to you and need a special enrollment period and might need to change a plan, and you might never have had to do that before. So just don't take for granted what you can do with a SEP. And then deadlines are SEPRICONs there tells deadlines are very important. You don't have to wait to open enrollment, and a lot of consumers still think that you do and will often, to their detriment, wait. And we want to make sure that people are well informed. Minimum essential coverage, we talked a little bit about this, but this could also be called qualifying health coverage, is any insurance plan that meets the ACA requirement for having health insurance coverage. There was a penalty before, obviously, that said you had to have coverage. Those of us doing this work for a long time know that. Newer folks having to deal with it at all. That's fine. But for the most part, these are things we think of as insurance: marketplace plans, job-based coverage, COBRA, Medicare, Medicaid, and CHIP. So things that a lot of times might end and then they get covered to the marketplace. We know, as normal sisters, generally speaking, we'll look at something and we can pretty readily identify minimum essential coverage. But be careful of things that look like qualifying coverage. We'll talk about examples of those. And remember that what we know as minimum essential coverage, or what we can easily identify as MEC, also, which you might also hear us call it MEC, A consumer might not. A lot of things look like minimum essential coverage or just health insurance to a consumer, and they don't have the education in this field. Why would they to do this work? So what they present to you and what they're calling health insurance, health coverage might not be minimum essential coverage. So always look really closely at those things. Look at the summary benefits, as our SEPRACON would say. Look at the summary benefits or other plan documentation. It'll usually be spelled out at the end. Sometimes it's not. That can mean that it's not, but generally speaking, for an actual qualifying plan, such as through the marketplace, you'll see that language, and I believe it has to be there by law. But when you should be able to find it if you're looking for it. And that will tell you, somebody says, hey, I've got this plan through a job and I think it's minimum essential coverage. It might not be. But so always look for that language. The loss of minimum essential coverage, MEC, is going to be your most common special enrollment period. Most of you on this call have probably done this already. Most of you have probably already done this year. Coverage must have been MEC. So you're talking about a loss of job-based insurance, Medicaid, Badger Care, student health insurance, COBRA, something that meets the minimum essential coverage standard. A lot of other SEPs will say, yes, you had to have had minimum essential coverage. So again, thinking back to that chart, look at that language. And you can sign up for a plan in healthcare.gov before the coverage ends to avoid a gap, right? And Medicaid, just a reminder, this changed over a year, 2 years, I want to say 2 years ago now, that you have 90 days to enroll in marketplace coverage. Hopefully, you are working with a consumer before that happens, so before they would even experience any kind of gap in coverage. But if somebody comes to you 73 days after they've lost Medicaid, you can still get them enrolled in the marketplace. Other common steps. Moving, you have to change county. Generally, you've changed zip code to move and get a special enrollment period through the marketplace. Changing household size, birth, adoption, marriage, divorce, or death. Changes in eligible immigration status. So again, thinking back to those pages, again, linked up in the slides. Release from incarceration or jail. These are all probably the easiest to access special enrollment periods that the application will typically recognize and allow you to use. Something to keep in mind for birth. Most special enrollment periods play relatively nice with each other in the application and will just work if you answer the questions correctly. Birth, if a household, somebody experiences a birth of a child, the birth date will often supersede whatever first of the month special enrollment period should have applied. So you may end up with a situation where you have the birth was on the 5th, and then coverage is starting on the 5th, and you wanted to start actually, could be the next month, could be earlier. It depends on what other circumstances are in play, but the birth of a child usually supersedes pretty much any other SEP in play. Julie, how are we doing on questions? Anything?
You are so clear that so far no one has any questions, but I am here to receive your unconfirmed thoughts.
Well, just wait until we get into these next ones. They'll be hopefully a lot more confusing. No, hopefully not more confusing, but hopefully they elicit more of a reaction, and they're things that ideally we have an audience where people have had challenges with some of these, and I would love to be able to clear some of that confusion up.
If people are typing and it's pertinent to your previous section, I will interrupt you before we move on.
Perfect. Love it. Moving out of the Medicaid coverage gap. So now we're talking income-based special enrollment periods. We're talking about things you might not think of right away. And in fact, there's a lot of people who won't think of moving out of the Medicaid coverage gap because they live in states that expanded Medicaid. Remember, Wisconsin, despite having a very generous Medicaid program, did not expand Medicaid. So moving out of the Medicaid coverage gap is one that you want to have in the back of your mind. It's an interesting one. In preparing these slides, we talked a lot about it, but you won't necessarily often see it because if somebody's moving out of the Medicaid coverage gap, it means they were in that gap, but then they didn't have Medicaid, so they're not necessarily losing their Medicaid coverage. So in a lot of situations, somebody will have had Medicaid coverage and you won't even think about the special enrollment period because it's just a loss of MEC. Now, there are, we can take for granted often doing this work that people we know what people's options are. You should have been on Badger Care. We'll see all kinds of things like that. But there are plenty of reasons people won't have taken Badger Care, didn't even know they should have had it. Remember that the breadth of experience that people have out there varies greatly. It could be an values thing. It could be didn't have any education thing. It could be a lost coverage and is very isolated and had no idea. But you will see eventually somebody who was below 100% of the poverty level and then gains income and for whatever reason is now thinking about health insurance. And because we didn't expand Medicaid, they should be able to get into the marketplace using the moving out of the Medicaid coverage gap SEP.
Adam, I'm going to pause you here. Let's before we go into that example, because it's
Perfect.
a complicated question, can you address, and I think we're going to come to this, some examples of when a consumer can change their plan through an SEP?
Yeah, we're going to get into examples of this. In fact, I'm hesitant to come up with them off the top of my head because I want to get to those slides and then expand on it there.
Thank you. I have another question, Adam. For the SEP for moving, the question states that they live on the border of 3 counties. If someone moves across the street, which happens to be in a different county, will that qualify for an SEP move? And do you have to stay in the same metal level? So changing counties, does that trigger an SEP?
Um, so easy part first. Yes, you should have to stay in the same meta level, unfortunately, with a move. The that should work. That's an interesting scenario, and it's one that I've seen. We have counties, obviously, in Wisconsin where there are zip code might be represented in 2 different counties. If it's an actual move, right? We talk a lot about when the moving step should start, for example. If they have access to a new property, if they're actually move, and you can say, yep, I changed zip codes, you should be able to access that step. And a refrain that I want you to keep in mind is something I said earlier on. I will say it again, which is try it. You know, try it and see. And if the site doesn't recognize the move when you actually do the application, go ahead and pick up the phone and call. I don't want somebody to not get coverage, especially if that is a county change and they have access to a new provider network, because that could be very, very important. Julia, any other thoughts on the moving one?
Well, I'll tell you a question that I had because I watched the CMS SEP webinar recently, and they were talking about, when you move, the technical languages is that you're supposed to report a move after you've actually moved, which in my mind then could create a scenario in which you may not have coverage in your new area
Yeah,
for several weeks. Can
we
you
have a
talk
gap.
through some ways in which we might look at that?
Yeah. No, thank you for bringing this one up. We've been exploring this one a lot lately. Yeah, the language suggests to report a move, after you make the move. One way that I know a lot of navigators, including myself, like to think about it is when do you have access to that new property, especially if that's the place you're going to get your mail. If you could go move right now, if you say you closed on a house or your lease started but you haven't fully moved yet, I would use it as soon as that date will let you. Basically, you want to avoid a gap in coverage the same way you would with anything else. Because if you move and then you aren't able to do the application because you're moving on the second, and you could have that gap where the coverage isn't going to start until the following month. So you want to make sure that the consumer has everything they need to say, yes, I have access to this property. Yes, I could move earlier. I want my coverage to start the first of the month, which is, I think, I look at, interpret, ask all the questions you need to find out if that's an option for that consumer, because you want to avoid a gap in coverage for the move set, because the last thing you want to be in a new area where you don't know a lot of things, accidents happen, certainly moving, could be a new area, don't know the roads, whatever it is, you don't want the consumer to experience a hardship and then have a gap in coverage on top of it.
Can I add another discussion point to the move SEP? And the question was, do you have to stay in the same metal level? Sometimes I will look on a chart and think that there's going to be a limitation. And when I actually perform reporting that change, I'm surprised at what I'm allowed to do. I think that goes along with your point of give it a
Yeah,
try, Adam,
yep,
because
it
there have been
does.
times when I didn't expect the outcome that would allow me to not only change meta levels, but possibly even change to a whole new qualified health plan. Um, and again, give it a shot and see what happens at the end.
Yeah, I love that advice. If the worker or the site is going to be more generous than you thought, you take that as a gift and you keep moving forward. As long as everything looks above board, you did everything else right. Nobody said anything they weren't supposed to say. If the worker or the site is going to be more generous, you take that and you go for it. All right, great questions. Love it. All right, so now looking at the moving out of the Medicaid coverage gap. So we got Amy, who's 33, just got a new job. It doesn't offer affordable coverage. She didn't have coverage previously, so say the last few months, but she has some income from temp and part-time work, but she was still below 100% of the federal poverty level. She might have very reasonably thought, as many consumers do, I'm working, I'm not allowed to have health insurance coverage, or I'm working, I'm not going to qualify for Medicaid or Badger Care, which is probably the most common form is that I just won't qualify. It's a lot of things, something consumers tell themselves. When her income then goes above 100% FPL, she starts that new job. She can get a SEP for the marketplace with no requirement of prior coverage, which is one of the cool things about the moving out of the Medicaid coverage gap SEP. You will need to call the marketplace to use that. You just need to explain to the worker that we are a state that's an expand Medicaid. And the Sepricon being an incredibly benevolent soul here, if they're in that circumstance, be sure to ask about past medical bills from the last 3 months, especially if they could have had dated Badger Care Plus. Um, I'll say this, a lot of times, things that get people to think about special enrollment period, especially people who are young and healthy, are often the need for care, right? So in this scenario, if somebody is moving out of the Medicaid coverage gap, what brings them to you might very well be a need for medication or a hardship that you want to make sure they have coverage for. So if you see one of these, it's always a good idea to ask the right questions and see if there's any need for backdated coverage. Because if they would have qualified for it, you absolutely should go ahead and do that and get those bills covered. Newly eligible for tax credits. These are ones that relate to, I think it's to Cheryl's question for when you'd want to change a plan, right? So if you were above, you say, yeah, 400% of the federal poverty level and your income goes down, so you're eligible for tax credits, and you're, say a consumer was enrolled in marketplace coverage, that can happen. When somebody meets with you during open enrollment, they might project a very favorable year and their circumstances might change. In which case they might come to you and say, "Oh, I need to update my income." And this is something to keep in the back of your head anyway, is that consumers should be reporting changes, right? And a lot of times that we tell them to do that, but it doesn't necessarily mean they will. But if somebody's income drops drastically and they're eligible for tax credits, they may very well come back to you and say, "What can I do?" And you could say, "Actually, let's look at one. You want to report that change and make sure they're getting that tax credit because they might really need it. It's going to save them a lot of money." But also, then if they need to change plans, right? Because we often see if there's a change in income, it could be accompanied with a health or a medical situation that requires, "Oh, we need to look at this other coverage." And this gets into kind of changing plans as well. We'll talk a little bit more about that in just a second about things to be aware of when changing plans. But sometimes the site will let you might need to actually change provider network. It could be a complex situation like that where it's, "Oh, you had coverage, but no, now you actually have to see the specialist 3 times a week, and they're only over here in this area, and this provider network wasn't in the plan that you were looking at." So staying at the same meta level, but then being able to see that provider could be critical to that consumer. Similarly, thinking about becoming ineligible for premium tax credits, again, it goes back to reporting a change where if somebody, we just lost those repayment caps. There were limits on repayment caps for consumers, even above 400% of the total poverty level. Now, if the income situation changes drastically and they're going to have to pay that income back, they may very well want to make that change. At the very least, you want to know when they come to you the implications. It's a good idea to know them at open enrollment because a lot of times people will express a number of factors that you'll want to kind of you're not going to be able to educate them perfectly, no matter how hard you try. But if you could kind of keep it in their mind that, hey, if something changes, call me, right? Like, so they know if they have an income change, because if their income, they become ineligible for APTCs, they want to know, hey, am I going to have to pay that back? So kind of keeping that in mind. These are options both for reporting a change and making sure that um, somebody isn't on the hook for tax credits, but also looking at their health situation. They may very well need to enroll in a different plan or make sure they have access to a different provider network. You'll see also in the chart that the newly eligible tax credits may be the result of a household change. There could be a birth and then I mean, that's got a separate step there, but it could be something where the household size has changed, which is you can do something with the dependent. You could put them in a separate plan. Maybe they have high needs. So there are a lot of kind of little scenarios around becoming eligible for tax credits, but a lot of it comes down to reporting changes. And a lot of it comes down to what is the implication. And your job as an enrollment sister, knowing the implication and being able to explain to a consumer, hey, this is going to save you money, or you're going to be on the hook for this at tax time or whatever, and then letting them make the right call for themselves is just an incredibly important part of this work, especially now that we've lost a protection as valuable as those repayment caps.
Adam, I thought because we're really rolling along, that I would share an example of someone who's the newly eligible for tax credit would apply.
Please.
I have a 25-year-old woman who works in a restaurant full time. They don't offer her insurance. Insurance is really important to her. And even though her income does not exceed 400% of the federal poverty level, when we enrolled for her, because younger people pay less for their coverage, older people could pay quite a bit more for their base plan. The plan for her was already considered affordable. That base price of the benchmark plan was already less than 9.98%
Yep.
of her gross income, whatever that is.
Yeah.
So she enrolled in a full price bronze plan because she needed to have coverage. Now she decided to go back to school and reduced her hours. When she came back in, now she was eligible for tax credits, which reduced the bronze plan that she was enrolled in. It did not allow
Yeah.
us to choose a different plan, but now she has tax credits that can reduce what she pays even further for her bronze plan.
Yeah, I love that example. Yeah, that's the other thing you might see, and that reminds me just of a scenario that comes up, especially when newer people do this work. They say, "Hey, I'm working with this young person. Why don't I have a tax credit? It looks like they should have one," which is a nice callback to that we do as we get ready to do this work. Usually in the fall as we prepare for open enrollment. But yeah, young people might very well have an affordable. It's passing the affordability test plan. So an income change might make them eligible for tax credits when their income said they would have had them before, but it just based on the plan prices in their area did not. So that's a really great example, Julia. Thanks. All right. Similar to eligibility for APTCs, but I would argue even more important, depending on the direction this is going, is the change in eligibility for cost sharing. So just kind of a reminder for people, cost sharing is that 250% FPL where silver plans start to look really affordable and attractive and the prices start to go down. I say affordable, I'm already doing air quotes in my head because it varies, right? It varies a lot plan to plan, area to area, and obviously those numbers fluctuate a lot based on what that income is going to be. So just knowing that, but you cross that threshold, you become eligible for the extra savings towards your marketplace coverage. You are then allowed to change, a consumer is allowed to change to the silver category and use those savings. That's huge, right? This is something, again, I want this in the back of people's minds when they're doing this work during open enrollment, people are picking a plan. Consumers will express all kinds of, you're projecting income for all of 2026 in November of 2025, and they're going to say a whole bunch of different factors, things that could change. What if this happens? What if that happens? So just knowing that, hey, if you become eligible for silver plan or cost savings, you could get those. And again, a lot of times we see life change. Income changes often come with things like health changes because the person's circumstance, they're often tied together. If it's an hourly job and there's something stopping them from working and their income drops, we see that. We know how those things are connected. So the other way, if you're enrolled in the silver plan, you lose your extra savings, you'll qualify for a special enrollment period. Um, you could change plans the other way. It's less common, but think about that the needs in the budget, and again, think about things like reporting changes, and even going back to the previous one, if somebody's income is going up and they're losing their extra savings, make sure they qualify for tax credits at all, because if they have to pay full price for that insurance, that could be incredibly expensive. And again, thinking about tax time, people always want to know, am I going to be on the hook for this if I get my income wrong? These all fit together to make a tapestry that it does take an enrollment assistor to understand and explain to somebody. Want people to remember all of these changes, especially where we have scenarios where you're changing a plan. Like some of these will open the door to changing a plan, and I mentioned some reasons you might want to do that, right? The network changes this last fall were incredibly impactful and had a lot of people reassessing, hey, which doctors am I going to? So they may very well have a medical change that makes them want to change a plan, but if they do, they're probably going to be restarting their progress towards deductible, out-of-pocket maximum. All of those things could be medication or prescription deductible as well. So sometimes that won't happen if they stick with the same insurance carrier, so the same health plan, broad health plan. But if they change to a new insurer, they're almost certainly going to be starting those over. Could still be to their benefit, but it's something to be aware of, because you don't want a consumer to be making that decision without that information. Julie, did you want to? I see you came back. Did you have another example here?
I thought we'd look again at our 25-year-old who
Yeah.
reduced their income at first. Let's say she took one class that still didn't put her in the cost sharing range, but what if school's going really well and she decides to enroll in a few more classes, work less? When she would report then her income that would put her below 250% of the federal poverty level, she could then choose a silver plan if that meant that her copays reduced, her out-of-pocket maximum would reduce, her accumulators, if she stayed in that same qualified health plan, would then reduce as you transitioned into that silver plan.
Mm-hmm.
So
Yeah.
again, some of that reduces not only your ability to get more cost sharing, but to your accumulating costs would also transfer with you and be reduced in total. Now, I'm going to also tell you a big mistake that I made early in my enrollment years, that somebody came to me and said, my income is increasing. If I add more income to the healthcare.gov application, does it increase my out-of-pocket costs? And I made the mistake of not using the window shopping tool to confirm that. I thought it wouldn't, and it actually ended up adding thousands of dollars of increased out-of-pocket costs by increasing her income. I was mortified. I actually used that opportunity to call the marketplace with her and say, I misrepresented, or I made
Yeah.
an error, and corrected that. But I guess the moral of that story is, before I help people make income-based changes, I preview it in the preview window shopping tool on
Yeah.
healthcare.gov so they can see this is what will happen if we report this change.
Yeah, I love that. I love the example, and obviously, that one's coming later. We'll be talking about the I made an error or misrepresented something. So that's a really good example. Um, but yeah, we'll get to some of that. I do really like that.
Since we're being interactive, I'm going to read a comment that
Okay.
is here in the Q&A that warns that if the 25-year-old who was not getting tax credits initially decided to add more credits or more work hours later in the year and goes above 400% of the FPL in this same plan year, she will owe all of that tax credit back.
That's it's a really good just general warning. And again, this is why if somebody's coming to you for a SEP, or if they're looking for a SEP, they're looking for health insurance, there's a reason we're asking questions about the whole year, right? Like it's similarly to the conversation we're having during open enrollment. Yes, we're getting them coverage and we're thinking about, oh, they might need a SEP later. Even if, yeah, I'm getting them coverage now, you want to know the last thing a consumer wants to be is surprised, right? And certainly not negatively surprised. And there is nothing worse than having to pay in, say all of your tax credits. So you want people to be very careful before they do that, and you want people to feel comfortable calling you back and saying, "Hey, I've got this change in circumstance. Can you explain to me what's going to happen?"
I have one more question here. It says, so you cannot enroll in a platinum plan if you lose your cost sharing reductions?
I saw that, and I will fully say that off the top of my head, I don't know. The language that I, found when doing the research for this, I don't think it mentioned platinum plans. I don't know if there's a special carve out. If anyone in chat wants to answer that, I find that we see fewer and fewer platinum plans, and that may be why that language was carved out. But I think that is a good question, because if there is a carve out or an exclusion there, then there's probably a reason for it. So I think we can absolutely take that one back, and I am fine saying I haven't encountered that, and I am not sure enough to give you an answer right now. Good question though. Yeah, and I wish we saw more plan variety, honestly. I think that would have solved that nicely. I could have said, yeah, I've done that, or no, I haven't. So thinking more about changing eligibility for cost sharing. I believe I referred to some of these this language here is that we'll tell a consumer to call us if anything changes. So again, thinking about SEPs even when it's not SEP season, or thinking about what's going to happen in 4 months or 6 months based on Julie's example. They're taking classes, they're not taking classes. Their job could change, their income could change. Consumers do need to report changes, obviously, but people are busy and they don't think about this all year round every day like we do. So they might not. But making sure that when you're working with them, when you have time with the consumer, you are informing them of the implications of their choices is huge. Just a reminder that going above below that 250% allows them to change meta levels, because that is becoming more and more rare. And then changing to a silver plan could save them a lot of money, especially depending on the cost of the care or the cost of the prescriptions. And then we had a nice question to set this up as well. If somebody's income is going up over that limit, we don't have those repayment cap protections, and somebody may want to change plans just to save on tax credits. Unfortunate as the situation is, there are a lot of financial considerations and not just health considerations in the work we do. I mentioned briefly the low income special enrollment period. Just because I don't like to put things in people's heads that are no longer relevant, but I do want to make sure people know that the low income SEP ended in 2025. Previously, you could use this. This was a great little backdoor you could use to sign up any time when people entered that income range. Thanks to the marketplace integrity and affordability final rule, it ended. There was some talk about it, maybe not, but it is effectively ended. Unless we see some other, national conversation around this, some other change to the payment parameters for the marketplace to bring this back. But it is over. So just if you have this one, good rule of thumb. If you look at that SEP chart on your wall and you see it, it's time to update it. You need to print out a new one and put that up. So low-income consumers need to qualify for another SEP to enroll outside of open enrollment. And hopefully we are giving you enough tools to say, hey, there are other special enrollment periods and we shouldn't have trouble accessing them. So I know that other avenues exist. I really liked, the interactivity we just had. Those were great questions and very timely. You could tell why Julie is here to make sure that they get asked when they should be. I really appreciate that. I don't see any open questions. I encourage people to keep them coming. I think we're doing exactly where I want to be on time. So I'm going to go ahead and keep going with less common steps. I mentioned at the top of the training nerding out over the stuff, and you want to work with a neural sister who really enjoys the challenge of this work. I enjoy looking at these. They're you don't see them all the time, but when you can make one of these work, you're going to feel so smart, and you're going to just, you can potentially change that consumer's life without being hyperbolic, I think. So unexpected situations like an unexpected hospitalization, temporary cognitive disability, otherwise incapacitated. We saw this one most, I would say, during COVID-19, right? There were a lot of unexpected hospitalizations, and those hospitalizations meant a lot of reduced interaction with the outside world, with other people, with resources that people might have used to get enrolled. Um, so similarly, I'm going to tie all these together in just a second, but or experiencing natural disaster. Similarly, it has to be one that was designated by the Federal Emergency Management Agency, or FEMA. Um, both of these circumstances, the way they work is that event, whether it was a hospitalization, temporary disability, or a natural disaster, it needs to have prevented somebody from enrolling during OE, during open enrollment, or during the window of another qualifying SEP. Um, uh, Again, you might not see this often, but it does happen. The most common instance you'll see of this is somebody who had hospitalization during open enrollment, right? Like that isn't that hard to do. It's winter, it's icy, people fall, they could have in the hospital for however long, and they need to go ahead and get a special enrollment period. And in this instance, I would say, even if it's pretty far after that instance, the effects of that, whether it is something as personal as an unexpected hospitalization or as broad as a natural disaster, a person could be dealing with the effects of that situation for a very long time. The fallout and the ramifications could be impacting that person to this day, to the day that they come and find you and say, I'm trying to get health insurance. So this is one of the situations where I tell people, go for it, right? If something prevented them from enrolling during their SEP window or during open enrollment, pick up the phone, call the call center. You have to do that to access these anyway, and see if it will go ahead and access. It says you have 60 days from the end of a FEMA designated incident period to complete your enrollment in the marketplace coverage. I am not convinced, even though the marketplace says that is 100% true. I would be explaining to somebody on the marketplace that this person could not enroll and they were still dealing with the fallout of that situation, and see if it'll work. There's a lot of situations where I want to know that I did everything I possibly could to get an individual coverage, right? Similarly, the language on the marketplace, again, you want to know what's hiding in healthcare.gov. I have not seen this done, and I'd be very curious if anybody else had, but I noticed this language when preparing this presentation, which is you can also have your plan start date be when you would have picked a plan if not for the disaster. I have my suspicions that is poorly worded, and that's not the intention. But as written, when you would have picked the plan and when that plan should have started are two very different things. So if anyone tries that, I would be very curious to see the results. I would probably expect an appeal of some kind tied to that, but we'll see. Again, these don't happen all the time, but if you encounter one, you're going to be that person's savior, and you're going to feel incredibly smart if you make this work. And thinking again about the links we use through healthcare.gov, getting the FEMA designation information for your area. I followed that link. It goes right to the FEMA site, and you put in your zip code. And the last FEMA related natural disaster we had in our area, and I think for a lot of the places in Wisconsin, was the flooding that happened in August of 2025. So it does come up. It might not be something as catastrophic as an earthquake or something that you might that might have derailed somebody, but it's a good idea to put in some zip codes and see if something did affect that area, because it very well may be that somebody was trying to enroll and their life got turned upside down by whatever that disaster was. All right, Julia.
I just wanted to open up the idea of listening to your people and how they describe what brought them to you. Most people are there not because insurance is exciting, but because they have healthcare needs. So I just wanted to point out this first one. The actual SEP is exceptional circumstances. And the language in the SEP chart says demonstrates to the marketplace exceptional circumstances that prevented enrollment during open enrollment, including a serious medical condition. If I heard from somebody anything that really prevented them from physically or mentally being able to get themselves through the enrollment at the time, and now they are here asking for my help, I'm going to think about this in a way that I can frame it to the marketplace call center. And I can't imagine that there's no requirement, I'm sure, to provide verification. I don't think. Have you ever used this? And could we just use it to say, listen, I was physically or mentally incapacitated at the time to complete my enrollment?
Yeah, I'm really glad you brought that up. I have done that, and what I ended up doing was basically as the navigator writing an attestation that this is what happened to that person. And again, this is a scenario where I wasn't sure it was going to work. Right? I don't like being in that area, but I'm certainly going to try. And in this case, it was someone who had a head injury, and their cognition was messed up for months afterwards. And that did work. I don't know that, I can promise that somebody that would work every time, but I can promise them that I would try it every single time and try and appeal afterwards because I think it should. A cognitive injury is no joke, and it absolutely is going to impact every aspect of that person's life. And honestly, I mean, getting health insurance should be so far down that list of things they're trying to recover at that point. But there should not be an extra barrier. So I have had that work, and I'm really glad you brought that up because it was a long time ago. But it's, again, I want people to try. I just go for it. Know that you did everything you can. Victim of domestic violence. Now we're already on a heavy one with cognitive disability, situation like that, natural disaster. Obviously, someone that could be an incredibly impactful situation, turn somebody's life upside down. It doesn't get more personal than this one, where you have a survivor of domestic abuse or violence or spousal abandonment. This is, it's in a way it's similar to a natural disaster, but it's so much more personal. Where there are even a few different rule changes, but you want to handle these situations obviously with as much tact and grace. You don't need any more information from that person than you need to understand that this is what's going on, and the marketplace needs even less than that. So just know that there is no verification requirement for this. That there really isn't. You just need to call the marketplace and attest that this is what's going on. This is the circumstance. Their dependents maybe they should be eligible too. I have done this, and this is one of the few scenarios with a marketplace application where it will let you, the guidance from CMS will tell you to do something other than answer a question exactly as the application says to, which is if a consumer is married to their abuser or abandoner, which happens all the time, unfortunately, they can answer that they're unmarried on the marketplace application, and they should. Um, that they need to have had prior coverage, but there's no plan selection limitation. I That is the language from CMS. I almost positive. I remember doing this without prior coverage, but I think it was because there was an open enrollment element to it. Now, this is a circumstance where, again, the marketplace does not need verification beyond somebody saying this has happened. And this is, again, one where with that, they can apply at any time. This is an incredibly heavy circumstance. And in my opinion and in practice that I've seen, it is not the marketplace's job to say, hey, this domestic violence or abuse happened too long ago. You can't get a SEP. So every time I have done this, it has worked. I have gotten them enrolled, and I think honestly that's as it should be. There should not be a restriction. No call center representative should be telling somebody, "Oh no, you were impacted so long ago that it's not going to work," because the impacts, the ramifications, the fallout, it continues. It continues to affect that person right up to the day they contact you and after. So just be aware of that. If somebody comes to you and you have a scenario like this, you should be able to get them coverage. I haven't had to do an appeal for one. It has worked every time I've picked up the phone. American Indian or Alaska Native. Take a breath after the last one. This is population I wish I worked with more because they have, frankly, the coolest and most generous marketplace rules there are. Um, Julie, I'll invite you to share the example you shared with me in just a second here, if you don't mind. But these can be used anytime during the year. Oftentimes, you'll see the language from the marketplace saying you can change as often as once a month. There are so many reasons not to change once a month, but there are many reasons to reassess your coverage and make sure that you've got the provider network you need. Make sure your plan is right based on your income, your family. But no requirement prior coverage. You just need to verify with documentation saying that somebody is a member of that tribe. Typically, it is easy enough for that person to produce. And then between 100 and 300% FPL, they should be enrolling without any cost sharing, which means they won't have out-of-pocket costs, which again, this is kind of how it should be, frankly. But I wish I worked with this population more and got to take advantage of this for more people.
I can share two examples of this. It was thrilling, actually. I had a couple come in who just had been uninsured for a long time. had gone through what I thought were all of the SEPs possible and asked about whether either of them were Alaska Native or American Indian. And one of them was, which was an entry then for this couple to get enrolled in any month. Um, it's something to certainly screen for. It was not something that I had ever done before. And interestingly, the person who was AI was able to take advantage of zero cost sharing, but the spouse was not. So that
Mm,
cost
yeah.
sharing applied to just the person who was eligible, but the SEP got them both in the door.
Okay, that's really cool. Yeah.
Yep, I have one more example. I just met with a couple who had very low income, but had been advised by, I think, one of their parents to enroll in an HSA plan because I can see why they did it. It looked like the out of pocket maximum would be lower on the HSA plan, but there was no what we call first dollar coverage,
Mm.
no copays, nothing that makes accessing care easy. Everything would go towards using your HSA or full negotiated insurance costs. And they couldn't even wrap their head around that at the time.
Yeah.
But because one of them is an American Indian slash Alaska Native, they could come back to me next
Hmm.
month or in July and say, okay, now we have time to think about what you were sharing. Can we make a change? And we'll be able to do that.
I like that a lot. Both of those are great examples. And you mentioned, this is something to screen for, and that's actually an interesting thought because a lot of times, and you've heard Julia and I both mention conversations you're having with a consumer. Um, this might not be the most obvious thing. This might not be something they volunteer at the top of an appointment. When doing this work, we don't like to be surprised. We like to have as much information in front of us as possible. But if it's not a population you're working with all the time, you might not find this out until you're actually in the application and you're asking questions about it. That generally, well, I will give you all the information and tell you how not to be surprised, but this one could still come up that way.
And I would expect that you'd need to be able to provide verification that you are registered with a federally recognized tribe.
Yeah. Yep. Misrepresentation. This is of all these kind of uncommon ones. This is where I've spent a lot of time in the past few years. Um, it's where I feel most comfortable. No, it's not. It is, but it's not. Healthcare.gov defines misrepresentation pretty broadly here. So it's misinformation, misrepresentation, misconduct, or inaction of someone working in official capacity to help you enroll. So your insurance company, navigator, CAC, and it kept you from enrolling in the plan that's right for you or getting the tax credit or cost sharing reduction you qualified for. So that's a lot of words. And you would think with that many words, that would be incredibly restrictive because it kind of looks restrictive, but at second glance, it's not actually. It's saying, someone working in an official capacity to help you enroll is a very broad category. The word inaction is incredibly broad. Basically, this just means that someone didn't let a consumer see all of their options. This means somebody told a consumer something wrong about their plan. This means that there was a better plan or that the tax credit should have been different. And frankly, we see different tax credits just by resubmitting the exact same information sometimes to the marketplace. We'll talk about that with errors in a second. But misrepresentation is incredibly broad. And now this is what we think of. This particular special enrollment period is what we think of for fraud and unauthorized enrollments, which have been on the rise for a couple of years now. And as unfortunate as that is, it is fixable. So when people, this is not the fraud and misrepresentation webinar, but at the same time, I want people to know what to do in these circumstances, which you'll see these a lot of times after open enrollment. People will get sold, or there's a lot of marketing that happens in conjunction with open enrollment period saying, hey, come buy this plan. And it won't be, whether it's a marketplace plan that somebody enrolled them in too fast without showing them all their options, or if not even a marketplace plan, which we'll talk about in a little bit here, it's not what they expected. And it is oftentimes that people learn that at the very inopportune moment when they go to use their coverage, right? They think they've got health insurance and it's not. So someone told them something that was not true. Which makes this, it is something you can verify. Again, this is one where you're picking up the phone to call the marketplace. The effective date may vary. The ideal situation is somebody finds this out, and before they get a major service or surgery or anything like that, no harm done. Actually, I would say a lot of providers are good at kind of catching these when somebody goes to use this insurance, which is a good thing. Um, it may backdate based on the nature of the inaction, but what you I see more often than that is, hey, I'm just going to fix this and we'll get it fixed for the first of the next month. I have done successfully appeals for these to get it to backdate based on how, grievous the inaction or the misrepresentation was in the circumstance. And we see some pretty bold bad actors these days, especially, we'll get into junk plans in a little bit and walk through an example of what that looks like. And again, not nearly as uncommon as you would think. Yeah, Julia.
Adam, what about a scenario in which someone in the course of selling you insurance tells you that a provider would be a network and then they're not?
I hate how likely that example is. um, so that would do it. Yeah, I would absolutely pursue that as a special enrollment period. And I think one of the reasons, at least Julia asked that, is because when we go to enroll people, especially during open enrollment, in those first weeks of open enrollment, the marketplace website can be wrong, can have very inaccurate information about provider networks. So if, I mean, that could be you, and that's not your fault, right? Like you're using the best available information, same as the consumer is. So if you make that mistake and the consumer goes to see that provider and finds out they're not in network, don't be afraid to say, I mean, there's an error step. We'll talk about it's slightly different, but the process is exactly the same. Don't be afraid to do what Julia mentioned earlier and say, hey, I made a mistake. But in this case, you could just say, hey, your site told us something wrong, and this provider's not actually a network. In which case, yeah, that's a special enrollment period.
So whether it's a malicious act or a mistake,
Yep.
it's worth pointing out that your information was misrepresented.
Exactly. Don't be afraid. Think about it. That word inaction, it's huge. It just means that something didn't happen the way it was supposed to. Someone didn't do X, and it's all it takes. Like I said, this is very broadly interpreted by the marketplace. Sometimes it can get messy, but the more fraud we see, which again is too much, the more common it is that the supervisors on the phone that you'll talk to, they know what it is and they fix it. I had a really complex one that I did, I feel like over Christmas. And I spent probably an hour on the phone with the supervisor, but she knew what we were doing and she fixed it. She had the power. She did it.
How does the marketplace ask you to verify that in any way? And I know we've got a lot of experienced people in the room. So Adam, your answer and maybe anybody else who has an
Yeah.
example, because this is a rife topic.
Yeah. I usually the verification, I don't know that I have been asked for verification at the point where it would ask for verification. Usually, and I'm going to explain what that means in just a second. I have explained this to death, usually, by the time it gets to the point of asking verification, that they're not asking me anymore. I have said, this is the plan. This is, you might show them a junk plan, which we'll look at in just a minute here. But usually I've said, hey, they have this marketplace plan and they shouldn't have. Somebody sold them this plan. There is no need for verification. This plan is just wrong, right? And if you have information like, an out-of-state agent, if you have their contact information, I've used that before. I've shared everything I've had with them before, but usually it's mostly just a verbal attestation at that point where I have, for lack of a better word, convinced the marketplace call center rep, yeah, this should not have happened, and they haven't asked me to submit anything proving it. Usually it's just a really long phone call. That's my answer. I don't know. Have you seen anything else in the Q&A or the chat where people have said something else?
Not on that topic, but I'll point people to read Kathy's answer about how she's assisted Native American Alaska Indians over the course of the year. I should have just forwarded that to everybody. Thank you, Kathy.
Yeah, I am going to keep us moving because I am somebody who's very aware of time, and I want you guys to have all of this information and not waste anybody's time. But I really love that we're getting the discussion in between. That's going to make me feel better when this is done. Uh, Errors and mistakes. So very similar to what we were just talking about. Let's invert that because we just got off topic where, yeah, you might make a mistake. And I want you to be not afraid to say, I made a mistake. And in fact, I polled navigators years ago and said, hey, has anyone ever done this? Has anyone ever called back to Marketplace? Julia just gave us a beautiful example not that long ago and say, hey, I made a mistake. this should qualify the individual for SEP. And I said, were there any negative ramifications for that? I had several navigators at this meeting who said, yes, this has happened. Yes, they used the special enrollment period. And no, the marketplace never came back and said, oh, you're not good at your job or your license is in danger. So don't be afraid to say you made a mistake. But even more likely than that, much more likely to that than that, is that the marketplace website is wrong. It happens too often, especially think about those early days of open enrollment, where the information on display, especially provider networks are rough. Medication listings I don't know that they ever get that list right. But again, it can be enough to trigger a special enrollment period. There can be a lot of issues with that. The problem, it's easier to say I made a mistake than to verify a technical error with the marketplace website. Something that I have done, but a consumer might not know to do is when you start working with consumer, I mentioned before that you could submit the exact same information and get two different tax credits. It happens sometimes. It's very strange, but it does. If I get something like that happens, I will take screenshots. Not with anybody's PII, no personally identifiable information in there, but I want something documenting the weirdness or the difference. And I'll take a screenshot of anything weird with the marketplace website just in case I ever need to do a technical error special enrollment period. Um, I would say most consumers don't know to do that, but if a lot of times you're giving somebody advice without actually helping them enroll, make sure that they have that in the back of their head. Like, oh, you're seeing this weird thing. Just go ahead and screenshot that, would you? You might need that information later. And I do think a lot of people will try it on their own, especially they might be calling you because they're encountering weirdness with the site or what they perceive to be weirdness. And usually document everything. If the site's telling you something weird that you don't understand, or it's showing you something different than you had when you had submitted 3 applications ago, go ahead and take a screenshot just in case you need to prove a technical issue with the site. Because otherwise that is very hard to prove. And I have not had to do an attestation for that. Usually there's something else going on. But when to pick up the phone, obviously we just talked about uncommon steps. They must all be triggered by picking up the marketplace call center. And again, they kind of vary by how common they are, how ready the person on the other line is going to be to help you with that. Steps for misrepresentation, errors, and mistakes may require an appeal. A lot of time, I'm finding less and less. I haven't had to do any appeals, although I have seen appeals going really fast lately, which is cool. If you have to call for SEP, this is a pro tip. If you have to call for SEP, make sure you've done plan selection with the consumer first, if possible. You want to respect your time, the consumer's time, even the call center's time. That you go to that preview tool, what Julie and I were alluding to before, because when you have worked with that person and you finally get the SEP to work or whatever it is, you want to be done, right? You say, we've already asked all the questions we need to ask. I can just pick that plan for you, hit enroll, pay the premium, we're done. That part's, you can save yourself a lot of time by, not trying to get the SEP and then going through the enrollment process. You can do all that education while you're waiting and say, hey, let's do this. And then let's pick up the phone and talk to a call center person. So keeping that in mind, plan selection first. And the reason I wanted to talk about is leave this bullet point in here also. Sometimes you'll have a SEP. I think we alluded to this a little bit, where the site will do something for you, or the circumstance will do something for you that you didn't realize was going to happen. And it might be you didn't fully understand it. It might be something weird is happening, but it is more generous than what you were anticipating when you helped that consumer fill out the application. I just be aware of that. I have had applications where there's been a SEP granted, and I look at their information, I look at everything they told me, and I can't for the life of me figure out what granted the special enrollment period. And I don't want to resubmit that application because I don't want it to go away. I don't, and something similar can happen when you pick up the phone. But like I have been afraid to resubmit an application because I don't want it to take away a SEP that was already granted that I can't figure out. So having that plan selected, then picking up the phone and calling the marketplace and saying, oh, they have a special enrollment period, putting it on them so you're not inadvertently taking away a SEP that's already been granted by the system is just good practice. So if you encounter a SEP that you don't see the genesis of, it's probably right. There's probably something that granted it that you're just not seeing, or the information that granted it is now a little bit different. You want to preserve that. Like I said, you just want to be really careful if you see one that's already on file. I think I worked with a consumer a month ago where I was like, everything you're seeing, I don't want to open up your application again because I don't want it to get messed up. So you will see that. But our SEP recon tip, if you know there should be a SEP available, so the opposite of that circumstance I just described, and the marketplace representative isn't giving you the right answer, for whatever reason, you'll get a gatekeeper on the phone every now and then. It happens. Go ahead and call back. Call back, talk to somebody else. So just summarizing briefly some steps that don't require prior coverage. We've got the birth, adoption, placement for adoption, foster care. Typically, this is meaning the new member of the family didn't have to have prior coverage because, again, thinking about a birth, they wouldn't. Newly eligible immigration status. You don't need prior coverage for that. Sometimes you will based on the country that they're coming from, but sometimes they'll have been here for a long time before the immigration status changes. American Indian or Alaska Native, thinking again about how generous that the rules are around that. Being determined ineligible for Medicaid during open enrollment. This one, around keeping the back of your head, there's that very distinct question on the application that did you try to apply for Medicaid during open enrollment? If a consumer can say, yes, I did try to apply for Medicaid during open enrollment, they can get a SEP later. So just know that, we don't have a ton of time to spend on that one, but if they can say, yes, I tried to apply for Medicaid during open enrollment, then they should be able to open that SEP door. It still works. And I don't think it asks, I'm trying to remember if it asks for verification now. If anyone wants to chime in with that, by all means do. Error, misrepresentation, inaction, misconduct, again, is almost as broad as it gets. Whether there was a mistake or malice, one way or the other, you can open that special enrollment door. And then exceptional circumstances, including FEMA, but it has to have been tied to some other opportunity they would have had to enroll in the marketplace. Oop. Okay. Other special enrollment considerations. Why am I going backwards? All right, losing coverage mid-month. This is just a reminder for folks. You might get a weird end date on your coverage, in which case you want to act before. The long and short is that you want to act before to make sure if somebody's losing coverage April 13th, they're not going to be penalized for getting a plan that begins April 1st. The period of overlap, dual enrollment does not impact APTCs or cost sharing reductions. Otherwise, they could have a gap. And a lot of what we've talked about today is about avoiding a gap in coverage. Oh, COBRA. Thinking about COBRA, if a consumer elects to take COBRA, they will not be eligible for special enrollment period if they choose to end their COBRA voluntarily. That's something to keep in mind because that can be very expensive, right? That can be a very expensive bit of ignorance if somebody does not know they could have gone to the marketplace. Now, if they took that COBRA, but they're still within that 60 days, they could still get that original special enrollment period. Then they can end that COBRA and just go to the marketplace, and they should probably. I say probably. I've seen a lot more competitive COBRA rates based on some of the marketplace plan rates, unfortunately. When an employer stops paying their portion of COBRA for the consumer, they will also be eligible for a SEP then. That's incredibly important. This is a language from the marketplace website, so you want to be able to point to this because it's not something a consumer might want to gamble on without the certainty. So you want to be able to show them, hey, yeah, I've got a severance and my employer's going to pay 6 months of my health insurance and then they're going to stop. Can I go to the marketplace? Yes. At that point, they can get a special enrollment period and they should act before that employer contribution stops. That way they won't have that gap in coverage. Looking at other SEPs for COBRA, if you have a COBRA scenario, somebody comes to you, they're on their COBRA, but then say they move out of the Medicaid coverage gap or they have a move. You can actually combine those with the COBRA. So say they have COBRA, that's existing coverage. So when you see that requirement of existing coverage, you can actually use that in conjunction with another special enrollment period, which means you can get them in the marketplace later. It doesn't happen often, but when it does, it works and it's pretty cool. Because they had prior coverage, they could go to the marketplace and get tax credits, and then they could choose to voluntarily end their COBRA. And then the last thing I want people to know about COBRA is that, again, while a consumer can't get a SEP by voluntarily dropping COBRA after the original SEP window, their dependent may very well qualify for a special enrollment period if they say, oh, I have the option to modify my COBRA. I want to keep it for myself to save $1,000 a month. Then their dependent that they're dropping could go to the marketplace and get a SEP, which is great. All right. Alternative types of coverage. This is alternative types of coverage. These are things that don't meet the requirement for minimum essential coverage. So we're talking things like short-term limited duration plans, also called junk plans, fixed dollar indemnity plans, accident or disability policies, healthcare sharing ministries, other things that look like these things. Um, Typically, losing or ending these plans doesn't usually trigger a SEP, not on their own, but a lot of times what we see is what we were talking about before. People who have these plans and products weren't told the full story. They were not, they were sold them. Somebody reached out to them during open enrollment and said, "Hey, I've got a great offer for you. It's going to beat the marketplace out of the water." Um, in which case, you probably, I say sometimes, but I think almost as often as I see these, sometimes I'll encounter a consumer who purchased these on their own, knowing what it was. They have an agent friend or, somebody who sells this type of product, and they got a pretty good rundown on what it is, and they don't have any expectations of it. But a lot of times, these will be marketed as full health insurance, and people expect them to do what full health insurance does. Um, so I just want to be really clear um, that this will often come with a fraud or misrepresentation special enrollment period. And I'm just going to run through this example quick. Try to speeding up a little. I'm going to go over time. I'm aware of that. I'm going to try not. I'm going to try to respect the knowledge versus the clock in this case. So we might not have time for questions, but I want people to have this information. So Gary bought short-term limited duration plan during open enrollment, worked with an agent from out of state. Again, that's always a red flag. He can't reach that agent. That's another red flag. That's usually what happens. If somebody is marketing them, someone's calling these consumers from out of state. It looked like minimum essential coverage, and that's what this person thought it was. They thought it was going to cover this upcoming medical procedure. I can imagine the person was vague, or maybe even they lied and yes, absolutely, it will. And he would qualify for a SEP for misrepresentation. In this case, I would even go so far as to do the appeal to get the coverage fixed for the start date. You would need to call the marketplace to make this work, kind of explaining what we just walked through a little bit ago. And then if Gary learned his coverage was a junk plan when he received medical services, again, you'll see this a lot. People who have these plans find out the problem when they go to get their medication, when they go to the doctor. So that person may need help with a financial assistance application. If that's in scope for your job, awesome. Help them do that. There's just it can be a very unfortunate position to be in when you have a junk plan and weren't expecting it, because a lot of people get these plans. They think they did everything right. They said, I got insurance. I got a great deal. I did what I was supposed to for myself, for my family. And it can really be a blow when they find out the truth. Verification process. We see obviously new guidance around verification, providing proof, right, for your plan a lot. I think we're seeing updates at least every year at this point. We're seeing them in real time, and they go from proposed considerations to oh, this is the new rule. I will say, similar to what we've been saying before, you always go as far as the application will let you go. So if it's going to give you a data matching issue, or it's going to say you need to verify this loss of insurance, whatever it is, if the application is going to let you go all the way to picking a plan, you pick the plan. The SEP will trigger after the verification for the situation is complete. And when documents are improved enrollment is complete, again, you pick that plan, you just log in, the consumer can pay their premium. The start date will obviously depend on the special enrollment period. The main thing I want people to take away from this slide is actually the tip from our little SEPRICON here, which is there is a difference between what federal policy says they're asking for, what they say, hey, we want proof and verification for XYZ. We're going to now ask for this and that. And those announcements can always be overwhelming, intimidating. Sometimes, like last year, we go, oh, well, we used to do that, and we were spoiled for a while and haven't had to provide verification. It's not that big a deal. A whole breadth of experience related to verifying considerations, but there's a difference between what they say they're going to do and what the actual application will do. I think more often than not, I see it be more generous or still just kind of take me at my word, or whatever the consumer situation is where I haven't had to provide verification. It's still erring on the side of I haven't had to provide verification, at least in my experience. It is shifting back. I think we've all seen in the last year or so experiences where we've had to submit things that that we haven't had to in a long time. We do see a shift back, but it's kind of an unusual circumstance right now where we just don't. You're not going to know every time. So just be aware of it. Don't miss it. Be very, when you look at those eligibility results, see if it's asking for something and help the consumer either way. If you're not asking for it, if they're not asking for it, take it as a gift and move forward. And remember, if you do need to resubmit that application, suddenly it could be asking you to verify something that was good a minute ago. So just keep that in mind. All right, gonna go through updates and resources pretty quickly here. New FPL numbers are out for 2026. Remember, when you're looking at marketplace coverage, you are looking back. So remember, always think about the last open enrollment period. What FPL numbers were they using then? Because that's for plan year 2026. I don't have time to get into these, but they're not SEP topics. But I did promise that I would go through some policy updates because we do every year. Couple Wisconsin specific updates: 12-month postpartum coverage for Medicaid and Gale's law for breast cancer screening. Both passed the Senate. I believe Governor Evers has issued his intent to sign those after this week, after the Senate period wraps up this week, I think is correct. And then just looking ahead, things we're going to talk about in the future: work requirements for Medicaid, update immigrant and eligibility for Medicaid and healthcare.gov. That's probably a webinar right there, if I'm going to guess. And you're going to be working with consumers. Please remind them to keep their contact information up to date with the state, especially for things like work requirements, right? As things change, they're going to want to know the latest because they're going to want to keep that badge card. Don't let anybody lose their coverage for something they absolutely either could have done or could have gotten an exception to. We have our special enrollment fact sheet. You can sign up for our listserv emails. Again, special enrollment fact sheet's updated. It's in English and Spanish. Probably not quite as detailed as this presentation, but it could be very helpful for you and the consumers you're working with. And yeah, our listserv emails will help you stay in touch with Cover Wisconsin, the different presentations we're doing, and anything else we put out that might be useful for you in your work. All right, live Q&A. Sorry, I tried to keep the speed respectable, if a little fast at the end there, because as I was aware, we were running out of time. Hopefully, that didn't throw anyone. Remember, this is recorded. If you have to go back and watch it at 0.75, go ahead and do that. That's what the information's there for. But Julie, how did we do on questions for the end there?
I think we've answered all the questions that are appearing in the chat here. Are you inviting people to come off mute and ask questions?
Oh,
Or do you prefer to have them in the Q&A?
I am happy to talk to somebody off mute. I would say, let's honor again, we're over time. Let's give people 5 minutes. And if somebody can come off mute, if I have that power, or somebody does, we can do it. I probably should mention, Elizabeth, if you haven't already, can you share the evaluation link in the chat? That should probably be done. Or chat or Q&A or wherever it should live. And then do I have the option to, are there hands up, or can people just come off? I think I have to give them the option, but I don't see any hands.
No hands, and I don't know if people can come off mute, but let's give some moments. Thank you, Alicia, for joining. She loved the Sepricon. Adam, you did a great job of being thorough. My biggest takeaway is to expand your view of what might create an SEP and give it a try.
Yeah, love it. Yeah. If nothing else, we should have highlighted a lot of different paths, stores, whatever you want to call them. And you're either working with a system that should work, and you should know how it works, but sometimes you got to talk to a human being, and no matter what, you go as far as it will let you go. You try everything, and once you know you've tried everything, if the answer is still no, okay, at least you can sleep at night knowing that you did everything you could to get that person coverage. That's how I feel about it.
Susan Stephen, who is a founding mother of this work in our lives, says she's always learning something new from us. So that's a high standard.
Absolutely. I love that. All right. Well, I do hope this is valuable. I want people to enjoy their St. Patrick's Day, so we will let you go. Thank you, Julia, for joining me, for chiming in with your insights, for adding context to this discussion. Again, there's nobody more passionate about this work, and I can't thank you all enough. Hopefully this helps you go out and enroll some people, get some people some coverage that they might not have gotten otherwise, and I wish you all a good rest of your year.